Distinguished guests, colleagues, ladies and gentlemen, good morning. I'd like to start by extending a very special welcome to a very special guest, Dr. Dominique Jordan, the president of FIP. So we are very pleased to have you attend the Africa session specifically. And I say that because both Merfin and I are representing the African continent, and we're really pleased to have the president attend this particular session. So my name is Sabiha Isak. I am the chairperson of the Global Respiratory Infection Partnership and the South African Research Chair in Antibiotic Resistance and One Health at the University of KwaZulu-Natal in Durban, South Africa. So welcome to this regional workshop to develop the African Roadmap for Action by Pharmacy. And I'm really honored to share this platform with Merfin and Mpundu. So a little bit about Merfin. Merfin is a public health specialist and a clinical pharmacist with over 20 years of experience in antimicrobial resistance. He is the head of REACT, Action on Antimicrobial Resistance for Africa, where he is responsible for strategic leadership in implementing REACT's strategic plan and activities in Africa. He builds partnerships with other stakeholders, including governments, supporting translation of evidence into policies and contributing to regional and global governance and catalyzing action to address AMR. I will begin with a brief overview of the workshop objectives. Merfin and I will then facilitate an interactive session to develop the African Roadmap for AMR Action by Pharmacy, and I will then end the workshop with a few next steps. Great. So the regional workshops actually build on the global session we held on September 12th, the recording of which is available on the FIP website, together with other webcasts and videos. So those of you that could not attend the meeting on the 12th, please be aware that this recording is available to you. And also to say that the recording of this African workshop will also be available on the FIP website immediately after this event. So please feel free to circulate that amongst your networks in pharmacy. So the objective of this workshop is to work together to drive regional initiatives in AMR by translating policy into action. During this workshop, we will co-develop and make a commitment to a regional roadmap for AMR success in pharmacy. GRIP is honored to partner with the International Pharmaceutical Federation to drive AMR action in a new decade by pharmacy. So the question is asked, why pharmacists? To answer this, I want to draw on the pentagonal framework of the Global Respiratory Infection Partnership. This framework speaks to the role of policy, prescribers, pharmacists, and patients on the prevention of antimicrobial resistance. So let us go through each one of these 5 Ps. The first P is policy, endorsed by local governments and clinical communities of practice that advance antibiotic stewardship and conservation. The second P speaks to patient empowerment and education about appropriate antibiotic use and symptomatic treatment options where available. The third P speaks to pharmacy guidance on their stewardship role as educators, providing patients with advice and support on infection management and when to consult a doctor. The next P relates to prescriber guidance on antibiotic stewardship and effective dialogue with patients. And finally, we have the prevention P, where we work with all of these parameters to prevent resistance by the rational use of antibiotics. So I would like to say that pharmacists are really pivotal in this framework, because pharmacists validate and confirm prescribing practice and therefore have tacit oversight of prescribers. We pharmacists are strategically placed to educate patients and effect behavior change in terms of patient demand for antibiotics. Pharmacists are critical to the implementation of policy, as well as the generation of evidence to inform policy-related interventions. And we finally prevent antibiotic resistance by impacting on prescribing practice, patient behavior, and policy implementation. For those of you that attended the global session on the 12th of September, Saturday last week, you will recall that we decided to focus on 3 of the 5 strategic objectives of the Global Action Plan on Antimicrobial Resistance. These 3 objectives resonate most with the policy and the practice roles of the pharmacist, and they are strategic objectives 1, 3, and 4 of the Global Action Plan. They are firstly to improve awareness and understanding of AMR through effective communication, education, and training, to reduce the incidence of infection through effective sanitation, hygiene, and infection prevention measures, and finally to optimize the use of antimicrobial medicines. And each of these strategic objectives could find an initiative in education, policy, or public health. And we want to bring in the COM-B model as well. So we wanted to incorporate the COM-B model because we believe that pharmacists have immense capability, opportunity, and motivation to prevent, contain, and mitigate antimicrobial resistance. Pharmacists have the capability to address AMR because they have the knowledge, skills, abilities, and proficiencies acquired via education and practice. Pharmacists are motivated to prevent, contain, and mitigate AMR and eliminate it as a public health threat. And finally, pharmacists, as either the first or the last point of contact within the health systems, but also playing a role as policymakers, regulators, as well as in professional practice, have the opportunity to achieve this by leveraging country commitments to the United Nations Political Declaration on AMR and the Pharmacy Association's commitment to the FIP policy statement on AMR. So the regional initiatives can address education, policy, or public health in any of the strategic objectives of the Global Action Plan. So let's get to the interactive part of this workshop, and we go with our first polling question. The first question is, has your country approved a national action plan? And you may answer yes, no, or I don't know. So Murphin and I know that the World Health Assembly resolution in 2015 required all of our countries to have national action plans ready by May 2017. We know that a number of countries in Africa, like other countries around the world, have not met this deadline, but we're very interested to know how many are formally approved. Just to say that with our interactions with WHO Afro, we know that every country in the Afro region has a national action plan in development, even though it may not be approved yet at governmental level. So let's see what our response rate is. So excellent, more than half of the countries in the African region have an approved national action plan. That's approximately 23 or 24 countries. That's absolutely great. And for those of you that don't know, please look at the Library of National Action Plans on the WHO website to determine whether your country has an approved national action plan, or go on to your Ministry of Health or Agriculture or Water or Sanitation websites, and you will find them there if they have indeed been approved. So we need the pharmacists to actually take a role in this. The next question, please, Carola. So for those of you that have said that your country does have a national action plan, can you tell me whether there is a clearly defined role for pharmacy in the plan? So has the pharmacy sector been identified as a stakeholder? And has the pharmacy role, whether regulatory, whether stewardship, whether dispensing or prescribing, been identified clearly within the plan? A number of action plans have very high level responsibilities, and they speak to, for example, Ministry of Health, Ministry of Agriculture, and don't necessarily identify the healthcare professionals. So let's see how pharmacy features in that. Okay, so about 60% say that pharmacy is clearly defined. That's really very good to hear that the African continent does see the role for pharmacy in playing in preventing, containing, and mitigating antimicrobial resistance. So that's an absolutely great result to hear. So let's then go on with the with the rest of the so we would like to complete this table with as many initiatives as possible. And we would like for us to focus on initiatives related to education, policy, and public health, and focus on the three strategic objectives of the Global Action Plan related to education and awareness, infection prevention and control, and optimal antimicrobial use. And once we populate this, we will then think about who would be responsible for implementing it, as well as what timelines we would see. And it's my pleasure now to hand over to Merthin to take us through the next few slides.
Thank you so much, Sabina. And thanks for all of you who have joined in this discussion. We appreciate that. And it's good to see that in at least I mean, over half of the countries that have developed the National Action Plan, there's a clear role of pharmacists in terms of being able to support with the implementation of the National Action Plans. We did actually do a survey. Those registered, we actually had questions out that focused on the three main areas of education and training. We looked at financial resources and institutional support, and also recognition and collaboration. The survey indicated that 47% of respondents were unaware or not actioning objectives outlined by the Global Action Plan in AMR. And the 5 key barriers that were subsequently identified are the following: education and training. There was, ongoing education and robust training modules on implementing AMR, mitigating strategies for actually pharmacists were missing in most of the setting, and this is actually causing a disconnect between the global objectives and also operational execution. And Sabia and I that are involved more in academic work, you discover that in most of the curriculums, even in pharmacy schools in the region, antimicrobial resistance is not adequately covered. It's only covered actually a little in most of the curriculums, and just when and it clearly actually shows even when we talk to the practicing pharmacists in the hospitals. The other area was around the financial resources and institutional support. Again, there hasn't been provision in most of the countries in terms of having a budget line that supports the implementation of National Action Plan, and also that provides really institutional support to be able to address the challenges that are there for AMR, but also the role that the pharmacists actually can play, and the other pharmacy schools that actually train diploma folks. There is also globally there is a lack of acknowledgement really of that pharmacy and its association with patient outcomes. And there is a sense in which there is really an overestimation of the capabilities of doctors in terms of AMR mitigation that results in lack of motivation for the collaboration between the pharmacists, doctors, hospitals, academicians, and the policymakers. And there isn't even a sense of working together in terms of recognizing that really pharmacists can be quite key, and are key, not can be, but actually are key, and they play a very vital role in terms of providing guidance, in terms of providing guidelines and policies that can support the mitigation of AMR. And the other area that is quite critical, really, to be able to achieve and to be able to implement the plans that are developed, we need accountability and leadership. And clearly, the survey indicated that there is a clear lack of accountability regarding the implementation and monitoring of AMR strategies. That is causing a gap in leadership. This is generating local ambiguities and low levels of commitment to furthering global and national objectives. The other area is around regulation and surveillance. There is little regulatory practices and lack of robust policy frameworks for antibiotic prescribing. This has created a barrier to curbing inappropriate antibiotic use. And there's also there's poor encouragement to increase surveillance from regulatory bodies that creates issues with reuse, sharing, and the improper disposal of antibiotics among patients. It's also it's different with the developed world where unused medicines, including antibiotics, can be returned at any pharmacy or drop-off points. We don't have those, and that creates actually a big problem in terms of getting these molecules really into the environment and into the water system that contributes to antimicrobial resistance. So these were some of the notable quotes that you provided. Low and middle-income countries like Tanzania have numerous health priorities to be supported with limited financial resources. Elements such as antimicrobial resistance, while being a priority, and specific plans and strategies are available, implementation often becomes a challenge, especially since the direct impact or harm is not widely known or observed. A pharmacist from Nigeria said adequate funding, training, and retraining of the pharmacists with respect to strategies involved in infection control and antimicrobial stewardship programs. And also from Kenya, the solution needs to be a multidisciplinary approach. AMR is not only a pharmacy's problem to solve, but we need to collaborate, and regulation is necessary. These are actually on point because really, and this is one of the challenges that has been in terms of moving the national action plans really in Africa, is that without the financial support, without the commitment by the government to provide the resources that are required, and to be able to actually promote and the collaboration across sectors, really, we've not been able to move as fast, really, and probably as efficiently and also as effectively as actually we could have moved as a continent.
But Mervyn, just before you go on to the next slide, I'd like to just weigh in here. I completely agree that it's not only a pharmacy problem. The Global Action Plan speaks about the whole of society engagement and the need for every person or every body, organization to become involved or mobilize around AMR. So it requires a top-down approach from governments, and it requires a bottom-up approach from the general population. I also want to pick on another key challenge that we are experiencing in Africa, like in other low and middle income countries, and specifically in terms of the implementation challenge. So many of the countries in Africa and other LMICs have actually have developed the national action plans, but are really struggling with implementation. And so the International Center for Antimicrobial Resistance Solutions, to which both you and I are affiliated, are really looking into how countries can be assisted in implementing the national action plans based on evidence and research. So over to you again, Mervyn. Thank you.
Thank you. So regarding the roadmap that Sabia had mentioned earlier on for pharmacy, the key areas that I would like to focus on are really actually around education, trying to work on building the capacities that can support with implementation, and also looking around at the policy and also the public health areas. So in terms of the strategic objectives, like said earlier, the focus is to be able to play a major role in improving awareness and understanding of AMR through effective communication, education, and training. As you well know, I think we have struggled really as a global community to find a good narrative around antimicrobial resistance that resonates and connects with people. And that's foundational. If we cannot do that, then it becomes really a major challenge to get actually people to react and get the traction. So some of the suggested initiatives that we're looking at are really mapping undergraduate curriculums actually for pharmacy against WHO competency frameworks on AMR for health workers. Also developing the pharmacy-specific world awareness week materials with the involvement of pharmacy associations and the regulatory bodies in countries. The area of reducing incidence of infection and through effective sanitation as a critical strategy and objective, really encouraging and being involved to encourage proper hand washing. We know that hand washing can reduce the passing of many harmful pathogens, and also really contaminating really surfaces, and also they reduce the passage of actual organisms, especially in hospitals that have got a higher risk. And so really promoting that, but also promoting very sensitive approaches and strategies in terms of vaccinations. If you look at the vaccination rates in the Africa region, for most of the vaccinations, we are actually under the global targets, and even the targets for the African countries. And so we do have the right vaccinations are really one of the strategies and programs and interventions that we should be involved in actually working on and spreading. In terms of optimization of use of antimicrobial medicines, we know that there is a lot of indiscriminate use of antibiotics and the other antimicrobials. In the region, in most of the countries, you can be able to procure these at the market, at the roadside, without a prescription. And also we know that there is also actually that that misuse also spreads into the animal and food industry. So the pharmacists actually can be able to integrate the aware categorization that WHO has developed and recommended, where actually the antimicrobials have been classified under 3 classes. The access, these antibiotics that should be available really all the time, and they've got a lower risk to create opportunities for resistance. And then the watch group is a group that that has to be really watched and taken care of, and being able to be steward, because the chances of actually being misused and getting into getting the pathogens become more resistant is actually higher. And the reserve one that include colistin, those should be used as last resort antibiotics. And so this classification actually helps in terms of being able to be actually good stewards, and being able to prolong the actions of antibiotics and mitigating antimicrobial resistance in that sense, but also really progressively implementing the pharmacy-led antibiotic stewardship programs in the hospitals and also primary healthcare settings. As we know, the pharmacists play a crucial role in terms of taking a leading role in stewardship. They gather the data, they support with the guidelines, they provide actually feedback in the clinical teams, and so those roles are very, very critical in terms of optimization of antimicrobial medicines in healthcare settings. In terms of In terms of
a bit of a break here and maybe do this first slide and then ask you to get on with the next one. So you must be a bit out of breath after doing that marathon session with those slides. So maybe I can start up and say the very first initiative that has been suggested is to map undergraduate pharmacy curricula against the WHO competency framework on AMR for health workers. So Carola, if you could put up the poll here. So basically what we would like to know from everyone is, by when do you think this initiative can be implemented in your country? So the World Health Organization has developed the WHO competency framework on antimicrobial resistance, and it also has a curriculum. And this has been targeted towards doctors, pharmacists, nurses, as well as lab personnel. So a lot of us already have AMR in our curricula, but if we want to improve it, enhance it, make it less of a silo and more of an integrated component across pharmacology, pharmacy practice, public health, regulatory pharmacy, etc., by when do you think this will be achieved? So I would like you to cast your votes now. And let's see what the results are. Okay, so people generally need 1 to 2 years to get this done. As academics, Murphy and I are very much aware of the fact of how long it takes to get all of these changes to curricula across all our regulatory procedures within the universities, within our professional councils, and within the Ministry of Education. But it is really heartening to see that within 2 years, we can amend our pharmacy curricula and get it more inclusive of antimicrobial resistance and antimicrobial stewardship. So Murphy, shall we share each one of these initiatives, and I hand over to you for the next one?
The next one is on developing the pharmacy-specific materials with pharmacy association and regulatory bodies. Can you go ahead? We see the poll on this one. By when could this initiative be implemented in your country? Either 2021, 2022, 2023, or 2024 onwards. We celebrate the WOW week every year in November, and so that might also help in the way you respond to that.
Murphy, yeah, you're quite right, Murphy. I think most of our countries do actually commemorate at least a day during that week and highlight Antimicrobial Awareness Week. I know that within our universities, our students get involved in putting up posters and flyers, and we run our public lectures in that area as well. And I know that React Africa is very much involved in developing the materials and circulating them across the world.
Yes, that's correct. So it looks like the 26% think that we can actually do this in 2021, and then we've got a higher percentage in 2022. I think one of the strategies here is that this is a global event, and all our countries are member states of WHO, and so they really actually would want to do a lot in this week, and I think it gives us an opportunity to be able to actually have activities every year. I think we can be able to scale up activities, and there are also, I think, lots of materials that we've developed. For example, React has, and we've been able to be involved with media. We've been able to be involved with journalists. We've been able to be involved with the professional bodies, and so really, this is something that we can actually do every year. The next one.
Says here, Murphy, that the GRIP, the Global Respiratory Infection Partnership, has really useful posters and pamphlets on antimicrobial stewardship, specifically in the control or in terms of upper respiratory tract infections, where antibiotics are very commonly prescribed, although they are not indicated. So please go with the next one.
The next one is by when could this initiative be implemented? That's the hand washing and targeting the home hygiene and also PPEs to prevent infections.
So here, Muffin, we're speaking also, talking about the community as well as the hospital or healthcare setting. I think we are so aware of hand washing and cleaning and disinfection with the COVID-19 pandemic. And just to say that there was an article or actually a news clip that was run by CNN in one of our African countries that showed that just supplying good and clean water in a specific hospital decreased the maternal and neonatal infections by 50%. So it's how important clean water and hygiene and sanitation is.
Wow, 71%. I mean, 79%, almost actually. 75%. Sorry, that was looking like a 9. I think I need to change my lenses. Yeah. So I think it's absolutely, and also, like, I mean, you had mentioned earlier on, Sabia, you know, generally we are actually either the first sometimes, or at least the last people that that patients are going to interact with, and because we practice in different areas, in community pharmacies, in hospital pharmacies. And so we interact so much really with members of the communities. And so we can take advantage of those and really ensure that we are educating patients and their families in that way. One other area that we again have said is very important is the promotion of vaccinations, including the seasonal ones for flus, for example, and being able to be actually advocates of these programs as a method or as a way to prevent infections. And we know that actually in terms of public health and vaccinations are really one of the most effective public health programs that the world has developed, or at least in this century we've had, because they prevented so many diseases, and it's a very, very sensitive way to actually support. So let's see the poll on this one. I mean, how soon or can we be able to implement this one?
So Muffin, we had a very interesting conversation in the last workshop, which was held with the European countries. And there was quite a bit of differences within the countries. In some countries, pharmacists were allowed to vaccinate themselves. And in other countries, there was quite a bit of contestation because they felt that pharmacy was stepping on the toes of other health professionals who were more qualified to do the vaccination. But just to say that in very simple terms, if you vaccinate, you don't get the infection. If you don't get the infection, you don't need the antibiotics. If you don't need the antibiotics or the antimicrobials, you don't create the selection pressure for resistance. So you're very right. This has been a key public health action in that regard. So maybe we can see the results, and Muffin, you can speak to what our countries think.
Yeah, you know, and I really, it's, you know, and the other areas that also where I think we need to actually play a very critical role has been in the area of those vaccines that are given, for example, say in 3 doses. There's generally a drop in the second and third dose for patients, again, especially in children. And you can see that actually the rates go down. And I think it's one of those areas, again, where we can play an instrumental role to actually raise that level of awareness and showing the importance of patients. I mean, especially children to complete the schedules of vaccination as recommended. Yes, and yeah, then they and it's very, very critical also. I mean, I will be able to see actually a lot of shift in the practice of actually pharmacy in terms of pharmacists really taking an upper role in providing some immunizations that we have seen, for example, in the US or in really in Europe, because I recall even when I worked in the US, when we started giving the vaccinations by pharmacists, we started with probably one or two. It was a flu vaccine, and then we started increasing the profile. And over time, the pharmacists actually offer really more than 10 vaccines. And so they've taken up really a very, very vital role, and they do that in communities. And so it's really easier for communities to come and get the vaccinations in that sense.
So maybe I can take this one, Murphy.
Yes.
Really speak about integrating the aware categorization into the essential medicines list and the standard treatment guidelines. So this is more of a policy issue, and it deals with the Ministry of Health and the drug policy, and where we have treatment guidelines and we suggest certain antibiotic treatments for the different infections. But here we want to take it one step further and suggest the access antibiotics, those that have the least potential for resistance, and then really keep an eye on those that are to which resistance develop quickly, and those are the watch antibiotics, and then finally reserve the broad spectrum ones for the multi-drug resistant bacteria. So if we could possibly find out from our and maybe these would be the policymakers and those working within the ministries of health, to tell us how easy it would be to integrate the aware categorization into the standard treatment guidelines and the essential medicines list. If you could run the poll, please. So again, any regulatory processes in our countries do require quite a bit of work, and the approval processes before they can actually be implemented become quite onerous in certain instances. And once these are actually incorporated into regulations, they would have to be implemented within the different hospitals, and the hospitals would have to be made aware of them and then start changing their hospital formularies, as well as address supply chain issues. So half the time we use the watch and the reserve antibiotics because we have stockouts of the access antibiotics. So supply chain becomes exceptionally important if we're really going to keep to the aware categorization. So, okay, 60% can get this done in the next 2 years. That's excellent. And more than 80% can get this done in the next 3 years. So this is really good. And we expect that you would interact with your ministries of health and your policymakers and the essential medicines unit within the Ministry of Health to really get the ball rolling on this as soon as possible. So thank you very much. And this is really good to hear that more than 2/3 of you would be able to do this within the next 2 years. I hand over to you then, Murphy, for the next one.
Yeah, just on the comment is it's important that we use these terms and be able to make them actually popular, and we use them in the EMLs, but also in the hospital formularies, and also to ensure that the terms are actually understood in the facilities. And on the next one is progressively implement pharmacy-led antibiotic stewardship programs from hospitals to primary care health facilities. Again, here there are a lot of really interventions that the pharmacists can actually do. I mean, these include strategies like, the stop orders by 72 hours after starting an antibiotic, to remind clinicians that they have to relook at the prescription for the patient, in the sense that really by 72 hours, if they are taken the cultures at the first day that the patient came in, then they would be able to be guided by microbiology and be targeted treatment. But other interventions also just include being able to convert actually from IV antibiotics to oral and to PO, but also based on the guidelines that the hospital has adopted. And so actually these interventions that are led by pharmacy you can always start with one, build up to 2 interventions, 3 interventions, and then ensuring that there is the communication really with the clinical team. And so here, let's see what the poll shows. I mean, how many of you will be able to do that in 2021, 2022, 2023, and
on the road
going forward.
pharmacy in antimicrobial stewardship, and I'm sure that the link to it will come up on the chat as well. So at a community level, you know, it's really for us to identify symptomatic treatment options and not move directly to the antibiotics. So the pharmacist would be the first line of treatment. And if it's a viral upper respiratory tract infection, we can certainly suggest symptomatic treatment as opposed to antimicrobial treatment. And again, I'd like to refer you to the GRIP website where all of these resources are available. So I'm sure that the stewardship is really focused on hospitals for now, but we need to implement them within the community as well. So over to you, Martin, to discuss the results.
Yeah. So in 2021, we got 30%, 2022 encouraging because some of these, again, they have to go through the policy process within the hospitals. And then of course, it's good that at least there is the commitment that's coming up. And, you know, it's been interesting as we have worked across the region, really promoting and training on antimicrobial stewardship, is that, you know, there is actually that appetite among pharmacists, doctors, and nurses to actually adopt these guidelines and for better outcomes of patients, but also to be able to contribute to slowing down and mitigating the effects of AMR. The next, yeah.
So what we've done is that we have completed the 6 initiatives. These are by no means all of the initiatives that are relevant. If you could have the next slide. These are by no means all of the initiatives that can be implemented in Africa. And so if you have other ideas, please put them up in the chat or in the Q&A box, and then we'll take these forward. So what we'd like you to do now is to choose the top 3 that you think would be most impactful, that will do the best they possibly can to address AMR in the African region. So we've had 6 in total. Please choose the top 3 that you think would have the greatest impact in your countries and more generally in Africa. So is it the curricula and the education? Is it the awareness by celebrating World Antibiotic Awareness Week? Is it the infection prevention and control by WASH and IPC? Is it vaccination? Is it the aware categorization? And finally, is it the stewardship? So let's see. And the winners are, and you can do the winners are on this one.
Yes. The winners, wow, MAP and ensure the undergraduate pharmacy curricula against WHO competency frameworks on AMR for healthcare workers. Then we have 66%. The last one of progressively implementing pharmacy-led antibiotic strategy programs from hospitals to primary care, absolutely. And the third one is offer childhood and seasonal vaccination programs and run vaccination advocacy programs to prevent infections. So yeah, those are the top 3 that have won.
Thank you very much for that, Mervyn. So as I was saying earlier, that these are by no means the only things that we can do in the African continent. You probably have even better ideas on what can be done and what should be done in Africa. So please use the Q&A and the chat boxes to list other initiatives. And all of these will be downloaded and handed through to the FIP AMR Commission, who will take these into consideration as they develop the roadmaps going forward. So I think, Susanna, I'm going to hand over to you in terms of any questions that we have for Q&A.
Thank you, Sabiha. Hello, everyone. My name is Zuzana Kusinova. I am the lead for policy, practice, and compliance at FIP. Thank you, Sabiha and Mervyn, for the very insightful presentations. I really enjoyed it. We have many comments coming from the audience, which is excellent to see. Please, everyone, continue to use the Q&A box to pose your questions. We have already received some of them. And we will select some questions for our speakers to answer now. So we will try to answer as many as possible via the Q&A box. And if we don't answer them live, we will also try to answer them via the Q&A box itself. So the first question is for Sabiha. And Sabiha, we are now in the middle of COVID-19 pandemics. What can we learn for the antimicrobial resistance?
So
Over to you.
Sure. So there are two types of learnings in terms of the COVID-19 pandemic. The first learning relates to the fact that AMR is a silent pandemic. It is equally, in fact, it will have greater repercussions than the COVID pandemic. So it is equally important for us to address the AMR pandemic as it is to address COVID-19 pandemic. I want to say that the COVID-19 pandemic is actually escalating AMR because antibiotics and antifungal medications are being used incorrectly. There are a number of rapid reviews that show that antibiotics and antifungals are used in 72% or more of patients, yet co-infections or secondary infections are available, in 3 to 8%. And I'm sorry, I maybe need to correct the percentages. So the overuse of antibiotics or the inappropriate use of antibiotics in COVID-19 patients are increasing the selection pressure for the development of resistance. So please, just to ensure that the pharmacists play a really important role in ensuring that there is antibiotic co-infection or secondary, there is bacterial co-infection or secondary infection before they start prescribing antibiotics in COVID-19 patients. The other repercussion for COVID-19 has that all of the health system's resources have been moved to respond to the COVID-19 pandemic. And things like antimicrobial stewardship, antimicrobial surveillance has suddenly become deprioritized. So we really need to leverage the COVID-19 pandemic, show that it is, that antimicrobial resistance is even worse, but it is a silent pandemic, and really make the alignments between the two of them to ensure that the public health agenda reinstates antimicrobial resistance and starts addressing it equally, because COVID-19 is actually escalating and exacerbating it. And maybe Murphan can give us a bit more insight on this as well.
Yeah, I think some of the reasons have also just that with a novel virus like COVID has been, is that it has caused doctors and clinical officers to use more really of antibiotics because they are not sure sometimes in what they are treating, and just that peer pressure, the prescribing pressure that patients also bring in actually adds another element. And there is also just a community-led with misinformation in communities. There's always a rush into the drugstores to go and procure. And so, these are some of the areas that we really can play a vital role in terms of providing the right information and also ensuring that we are the gatekeepers also where we've got the responsibility of being able to actually give out these precious molecules.
Okay. So the next
Thank you very much. Thank you very much, Sabiha and Murphy. Of course, every crisis is bringing opportunities for learning. So as you kindly said, it's especially good to learn, and also it gives us the opportunity to prioritize AMR on public health agenda. We have many more questions coming in. The next question is about funding. There are participants that are relating with the struggle with finding fundings. Sabiha, you mentioned already that there is Wellcome Trust and NIH that could provide some funding for both training and research. Would you like to expand on this?
Sure. So AMR Research Funding, at the moment, COVID-19 is the flavor of the month, and everybody's funding research on COVID-19. And if you look at several portals, the Frontiers portal, for example, there's quite a bit of work being done in terms of funding for COVID-19. The British Society of Antimicrobial Chemotherapy, and Philip Howard is one of our panelists here, gives funding for this. The Infectious Diseases, ISID, International Society for Infectious Diseases, I forget my acronyms each time. It's also offering funding for AMR, as is the Wellcome Trust that has a dedicated AMR unit and has several investigator and country and collaborative grants. And the National Institute for Health in the US also sometimes focuses on infectious diseases generally that can be leveraged towards AMR. I think your national funding bodies within your countries, your medical research councils and your research foundations would also fund. But then the African Academy of Sciences also has funding opportunities. Muffin, maybe you can expand a little bit on what we have specifically in Africa.
I mean, you've highlighted actually the major ones, but it would also be, I think, of interest to mention one newcomer in terms of really funding and supporting our demonstrations project in low and middle income countries, and this is the International Center for Antimicrobial Resistance Solutions, ICARS. It's one of the babies that are on the block, but they will play a vital role in supporting countries. So we can actually input really into the proposals that countries develop, as most of you, I believe, or at least some of you actually sit on the national coordinating committees at country level for antimicrobial resistance, and so you contribute in the ideas and prioritization of activities in National Action Plan, and so that would be one avenue that that is important to look out for, and also I think looking out for actually cause under the JPIMR again another group that that funds in terms of projects and research. In terms of AMR, and so there are quite a number of funders really in the space, and we can actually continue circulating this among the group as we move forward if we have any new funding opportunities coming up.
And just to say that this would be one of the priorities of the FIP AMR Commission. First of all, to determine a research agenda, but also then to identify funding sources to implement the agenda. And what Murphin speaks to in terms of ICARS requires you to go via your Ministry of Health or any of the other ministries if you're working in different areas. Susanna, we have like 3 minutes for a few more questions, and then I'd like to go on with the next steps, please.
Yes, thank you, Sabiha, and also for mentioning the event that is coming up on the 24th of September when we will be launching the AMR Commission from FIP. So the last question is, how can community pharmacies deal with patient demands for antibiotics? Sabiha, would you like to start?
Sure. So let me again defer to the GRIP materials. This is one of the key aspects that we dealt with, specifically in the context of upper respiratory tract infections. But basically what we do here is take the patient through an education process to explain exactly the fact that, for example, the upper respiratory tract infection is usually of viral etiology. Antibiotics won't work against it. Antibiotics have side effects and adverse effects, not the least of which is antimicrobial resistance. And again, I see in the chat that Ashlyn has put up the resources, and in community, it's just a matter of educating your patients and explaining to them that antibiotics may not be the obvious choice. And in a number of the more recent publications, the demand is actually not so much as demanding the antibiotics, but the need for reassurance. This is normal. It'll take so many days to get over. These are the symptomatic treatment options. Please consider them first. If you don't get better, if it gets any worse, then we would suggest that you go to your doctor. But otherwise, symptomatic treatment is an option. Murphin, you'd like to take that in a minute before I start rounding up, please. Thank you, Suzanne.
Yes, it's been actually very highly debatable. Actually, in a number of countries that I visit, and one of the arguments is always towards the fact that between 40% on average or so of the sales of medicines in some of the drugstores or pharmacies actually come from antibiotics, and so there is the issue to deal with in terms of the bottom line. And I think some of the things that really we can, from what Sabia has said, it's we really have to be actually truthful with our patients, and we also have to really talk about other products that might help. Probiotics, for example, they could actually help, and also really getting them to see the right doctor if they have to see a doctor, because I think once we do that, they start seeing the difference and they start believing that this is the best way to be able to respond to these products when we are sick, and there is the trust that actually gets built up. And so I think we really have to rely on our professionalism here, and to really commit ourselves to ensuring that we are not the ones that are making the problem worse by just being insensitive to the drivers of AMR.
Thank you very much for that, Murphy, and thank you, Susanna, for running the Q&A for us. I really appreciate it. So what are our next steps? So the very obvious next step would be to take all of this information that we have collected from the survey, as well as from your inputs on the chat, and use that to develop the regional and global roadmaps, and these will be published. And then we have a series of Pharmacy Week activities related to AMR starting next week. So those of you that attended the meeting on the 12th, the CEO of FIP, Catherine Duggan, announced the FIP AMR Commission and also made mention of the FIP development goal related to AMR. And this development goal is going to be launched on the 21st, on Monday next week. And the FIP AMR Commission will be launched on the 24th of September at 1 o'clock Central European Time, and you are all invited to attend. You may register for both the developmental goal launch as well as the commission launch on the FIP website. The very first deliverable of the AMR Commission will be the regional and global roadmaps for AMR containment in pharmacy. Could we have the next slide, please? So what we've done today and over the last 2 days has really been to identify key actions and engender regional commitments to AMR action in pharmacy. So this is the sixth and the last regional workshop. We've held them in all WHO regions. And just for you to know that the AMR Roadmap is designed to be a living document, an iterative tool that will act as a compass to guide action globally, sustaining momentum and evaluating progress in pharmacy. It is meant to be revised annually, culminating in a presentation at the FIP World Congress in 2023, where a special health ministers summit will be held. The FIP 2023 is going to be held in Cape Town, South Africa, and we look forward to welcoming all of you there. And we really look forward to your continuing engagement with the roadmap, and we count on you to implement it in your countries and your region. Make sure that pharmacy becomes visible and takes on the leadership role in AMR mitigation, and really play a key role in stopping or addressing AMR in the African region. I'd like to end with a few acknowledgements. All of these workshops would not have been possible without some very important and key people. So I'd like to acknowledge Catherine Duggan, the CEO of FIP, for advancing the antimicrobial resistance and antimicrobial stewardship discourse within FIP, Adrian Shepherd for his advocacy and leadership of GRIP, and then Jane, Erin, and Ashlyn from Cello Health, and Carola and Susanna and Mila from FIP for your invaluable support. Thank you, Murphy, for partnering with me as the African facilitator. Thank you, Dominique, for gracing us with your presence at this workshop. Thank you very, very much, finally, to all of the participants. For those of you that woke up early to attend this, we really appreciate your inputs and your valuable insights. Thank you for engaging. I know that the chat was exploding, as was the Q&A. Thank you for engaging with us, and please continue to engage with us as we address AMR on the African continent. Thank you all very, very much. Have a great day further, and goodbye.
Thank you.